Hi, nice to meet you. I will talk about the anatomy of the stomach. Please give me a like and also subscribe to this channel. Thank you. We will talk about the anatomy of the stomach. The stomach is the most dilated part of the digestive tube, having a capacity of 1000 to 150 millimeters in the adult. In this video, we will talk about the external configuration of the description about this organ, the function, the parts, the size, the curvatures, and the surface. Also the internal configuration that are the openings, also the omens, and the blood supply, every artery that drain through the organ, and also the lymph nodes. First of all, we have that the stomach occupies the left upper quadrant, the epigastric quadrant, and the umbilical regions. The stomach lies under the cover of the ribs, and it is located at the level of the T10 and L3 vertebrae. We have on the description that the stomach is a J-shaped organ in the upper region of the abdominal cavity, and it is the continuity of the esophagus superiorly and empties into the duodenum of the small intestine inferiorly. Also, in the function, we have that this organ is divided into two functions, the mechanical and the chemical digestion of the bolus. After these components are completely processed in the stomach, the product is called chyme. The principal function of the stomach is to mix the food with acid, mucus at pepsin, and then release the resulting chyme at a controlled rate into the duodenum process of the absorption. The gastric motility is controlled by both neural and hormonal signals. The nerves control originates from the enteric nervous system as well as the parasympathetic, predominantly vagus nerve, and the sympathetic systems. The principal parts of the stomach are the cardia, the fundus, the body, and the pylorus. The stomach is divided by the pylori part, the body by a plane passing through the incisura angularis on the lesser curvature. The body is divided into the fundus and the cardia. Both of them, the fundus and the cardia, is passed by a plane through the cardiac orifice. We have also the organs associated with the stomach. In the anterior part, we have that it is associated with the left lobe of the liver and the anterior abdominal wall. In the posterior part, it is associated with the abdominal aorta, the pancreas, the spleen, the left kidney, and the adrenal gland. Also, in the superior part, it is associated with the diaphragm, the esophagus, and the left lobe of the liver. Inferiorly, it is associated with the transverse colon and the small intestine. To the left, it is associated with the diaphragm and the spleen, and to the right, it is associated with the liver and the duodenum. On the size of the organ, it is a very distensible organ because of these glands. It is about 25 centimeters long, and also the mean capacity of this organ is 1/1 of 3 millimeters at the birth, and then 1 liter of 1000 millimeters at the puberty, and in adults uh, it is like 1.5 to 2 liters or more. The stomach has two curvatures. The first one is the lesser curvature. This curvature is called also the curvatura ventriculi minor. These kind of curvatures are extends from the cardiac to the pyloric orifice, thus forming the right or posterior border of the stomach. It is a continuation of the right border of the esophagus and lies in front of the right cross of the diaphragm. It crosses the body of the L1 and ends at the pylorus. On the another curvature that is called the greater curvature or the curvatura ventriculi major, it is directed mainly forward and is 4 to 5 times longer than the lesser curvature. It starts from the incisura cardiac and the arcs backward, upward, and to the left. The highest point of convexity is on a level with the sixth left costal cartilage, and it then descends downwards and forwards with a slight convexity to the left as low as the cartilage of the ninth rib, and before turning to the right to the end at the pylorus. This incisor angularis is also found aside of the greater curvature. It is like the opposite of this curvature, which is the left extremity of the pyloric part. Also, the portion between the sulcus intermedius and the duodenopyloric part is constricted by a pyloric antrum. We have also two surfaces that we can find in this part. The first one is that and this anterior surface is covered by a peritoneum and lies in contact with the diaphragm, and also it is separated from the base of the left lung with the pericardium on the seven uh, ribs and also at the intercostal spaces of the left side. The transverse column may lie in the front part of this surface when the stomach is collapsed. It is indicative of a collapse that can be found in this pathology. Also, we have the posterior inferior surface that is covered by peritoneum, except over a small area close to the cardiac orifice. This area is limited by the lines of attachment of the gastrophrenic ligament and lies in a position with the diaphragm, and frequently with upper portion of the left suprarenal gland. Other relations are to the upper part on front of the left kidney, the anterior surface of the pancreas, the left colic flexure, and the upper layer of the transverse mesocolon. Also, we have two openings. The stomach has an initial opening that it is a relation with the esophageal junction. This relation is communicated with the via by the cardiac orifice, which is situated on the left on the midline at the level of the T10 vertebrae. The intra-abdominal esophagus, that it is called the antrum cardiacum, is short and conical. Also, the right margin of the esophagus is continuous with the lesser curvature of the stomach, while the left margin joins with the greater curvature at an acute angle that it is called the incisura cardiaca. Also, we have another opening that is lower that is called the gastroduodenal junction. The pylorus forms the gastric outlet and communicates with the duodenum. It lies to the right of the midline at the level of the upper border of L1 and may be identified from the surface of the stomach by a circular groove. Two kinds of fomenta. The first one is the lesser omentum. This extends from the inferior and posterior surfaces of the liver to the stomach and the proximal part that it is the duodenum that is 3 centimeters long. The free border of the lesser omentum is between the portal hepatis and the duodenum contains the hepatic artery, the portal vein, the common bile duct, the lymph glands, the lymph vessels, and the nerves. Behind this free edge is the opening into the lesser sac or the epiploic foramen of Winslow. Also, we have another omentum that is called the greater omentum. This is formed by a greater curvature of the stomach by the union of the peritoneal coats of the anterior and posterior gastric surfaces. On its left, it shortens to the gastrosplenic omentum containing the short gastric branches of the splenic artery between its two layers. On the right, it is continued for 3 centimeters along with the lower border or the first part of the duodenum. In this part, we will talk about the blood supply that usually it is the first one and the most important part is the left gastric artery. This left gastric artery is the main branches with the hepatic artery and the splenic artery. This artery runs to the left, gives off an ascending esophageal branch, and supplies the upper part of the stomach. However, it may arise directly from the aorta, like in the 5 or 6.7 percentage, and also it may be the one that provides one or both of the inferior phrenic artery of the common trunk for the two ones. Also, this left gastric artery turns downwards between the layers of the lesser omentum and also runs right along with the lesser curvature. The next artery is the hepatic artery. This is the second branch of the coeliacal trunk and passes downwards as far as the right as the first part of the duodenum. At the opening into the right border of the lesser sac, it turns forward in the epiploic foramen and curves upwards between the two layers of the lesser omentum towards to the porta hepatis and the supply on the liver. The gastroduodenal and the right gastric arteries are given off as it turns into the lesser omentum. The right gastric artery passes to the left between the two layers of the curvature of the stomach before divided into the two branches that are anastomose with the branches of the left gastric artery. Also, we have another artery that is called the splenic artery that passes to the left along with the upper border of the pancreas behind the peritoneum and the stomach to supply the spleen. The division into the terminal branches close to the spleen is called a magistral splenic, that it is like 1 or 2 centimeters from the hilum. But earlier, the division is called a distributing splenic. During its course, it gives us branches to the pancreas just before entering the splenic hilum, and it gives off the short gastric arteries supplying the gastric furnace and the left gastroepiploic artery. Later, it passed downwards to the right along with the greater curvature of the stomach, between the two layers of the greater omentum, to anastomose with the right gastroepiploic artery in the mid portion of the greater curvatures. Also, it gives off branches to the anterior and posterior gastric walls, which anastomose with branches to the gastric arteries along with the lesser curvature. Um, we have another definition that it is called um, the left gastric veins, that it's part and the first one and the most important venous drainage of the gastric veins that are in similar in position, also to the arteries along with the lesser and greater curvatures. The left gastric vein runs to the left along with the lesser curvature, receiving the esophageal veins below to the esophageal um, hilum or the hiatus in the diaphragm. It usually drains directly into the portal vein at the superior border of the pancreas. We have also the right gastric vein that runs along with the lesser curvature to the right towards to the pylorus, posterior to the first part of the duodenus, and it joins to the portal vein. It also receives the prepyloric vein, which receives the veins from the first 2 centimeters of the duodenum. We have also the left gastroepiploic vein. This passes to the left along with the greater curvature and with the short gastric vein that drains into the splenic vein, or the also with the tributaries. The splenic vein is joined with the tributaries from the pancreas as well as the inferior mesenteric vein. Also, this last one forms the portal vein with the superior mesenteric vein. We have then the right gastroepiploic vein. Usually, this gastroepiploic vein joins with the superior mesenteric vein and thus drains into the portal vein. However, there are considerable variations that may occur on the right gastroepiploic that may enter to the portal vein directly, or it may join with the splenic vein. We have then the lymphatic drainage. These gastric lymphatics arise in the subepithelial or interglandular tissue of the mucosa. They pass outwards between the glands to communicate with each other in the periglandular plexus, and from here the channels proceeds into the subangular plexus between the glands and the muscularis mucosa. Also, the lymphatics of the stomach can be divided into three kinds of systems, or three systems. The first one is the intramural part that consists of three networks: submucosal, intermuscular, and the subserosal. The submucosal lymphatic channels communicate freely throughout the submucosa of the stomach, to a lesser degree into the submucosal lymphatics of the duodenum. The intermediary part consists of numerous small channels between the subserosal network and the extramural collecting systems. The last one is the extramural part that consists of four major zones of the lymphatic drainage corresponding to the arterial supply of the stomach. Ultimately, all zones drain into the colic nodes around the colic arterial trunk on the anterior aspect of the aorta. Another definition that we have is that these kind of nodes or lymphatic gastric drainage are divided into 4 zones. The first zones, this kind of upper 2 tiers of the lesser curvature and larger part of the body of the stomach. The first zone drain into the left gastric nodes, lying along with the left gastric artery. These nodes are joined by the lymphatics coming down from the lower part of the esophagus. The two zones um, arise from the distal part of the lesser curvature, including the lesser curvature of the pyloric region, to the suprapyloric nodes along with the right gastric artery. The zone 3 includes the pyloric part of the stomach as well as the right half of the greater curvature. The lymphatics from these areas drain into the right gastropiploic part of the gastrocolic ligament, along with the lying gastropiploic vessels. In this last part of the video, we have the last zone that it is the zone 4 that comprises the left half of the greater curvature and the gastric fornix. We have also the nerve supplying of the stomach. This supplying of, or the concept that we have on the autonomic nervous system consists of 2 components. The cholinergic, that mostly is the parasympathetic part, and the adrenergic, that it is mostly sympathetic nerves. However, a third component of the autonomic system, which is neither the cholinergic nor the adrenergic, has been recognized within the gastrointestinal tract. The peptidergic system is called. They release a purine nucleotide as the active substance. An increasing number of peptides that are released have been recognized, and this has led to the concept of a 3-part autonomic control system consisting of cholinergic, adrenergic, and peptidergic nerves. These peptides are unique, with a dual localization in the endocrine cells and the peripheral nerves in the wall of the gastrointestinal part. We have the parasympathetic nerve supply. It is composed by the first one, that is the first nerve, that is the anterior vagus. This is derived mainly from the left vagus nerve, but also includes the fibers from the right position of the vagus, and some are also sympathetic fibers from the splenic nerves. It enters in the abdominal cavity through the esophageal hiatus into the diaphragm. It is usually single but may be divided into multiple trunks. Also, it is divided into some branches. That these are the first one, that is consists of 4 to 5 direct branches that we can count from here. The first one, the second one, the third one, the fourth one, the fifth one, that are emanated one below the other to supply the upper part of the lesser curvature. We have that these nerves do not form a plexus, that it is a few filaments from the sympathetic supply joined these direct branches via the coeliac plexus. Also, we have the set 2 to the branches from the vagal supply to the liver. There are usually 3 to 5 nerves. This kind of and nerves are descended into the lesser omentum from this part, but we don't have the right under or the complete image. So this is the best that I found on the internet. Also, we have another nerve that is the posterior vagal. This posterior vagus is mainly formed by fibers from the right vagus nerve and enters into the abdomen posterior to the esophagus. After entering the abdomen, it divides into two main branches. That are the first one, that is the coeliac and the posterior gastric. The coeliac and the posterior gastric. This is the posterior gastric, this is the anterior gastric, that are the division of the nerves that are also called the nerves of Latarjet, and this is the anterior gastric, that are branches from the post-vagal that also are part of the another branch that is the celiac division. So, repeating this part, the posterior vagal gives two branches. The celiac division, that is the posterior branch, and the posterior branch gastric, that it is the another branch. The posterior vagal gives the celiac division and the posterior gastric. And the anterior vagal will give a set up of branches that are mainly 5 to 6, depending on the content, and it is also gives the nerves of Latarjet that are also called this set up of branches, and it will give another branch that is called the hepatic division of these nerves. We have also the sympathetic nerve supply that is derived almost entirely derived from the coeliac plexus. The gastric branches of the coeliac plexus are with the vessels supplying with the stomach, the left gastric, the hepatic, and the phrenic arteries. Also, we will talk about a little bit of the pectidergic system. This system of the pectidergic cells are derived embryologically from the neuroectoderm and also refer to the cells that are called the APUD cells, because they synthesize this kind of cell. The APUD cells synthesize the monoamines through a process of amide precursor uptake to the decarboxylation. There are a large number of biological active peptides that have been detected in these APUD cells within the gut. These peptides include gastrin, the vasoactive intestinal peptide, and the somatostatin, the enkephalin, the neurotensin, and the substance P. Well, we finally finished this part of the video. I will continue to talk about the second part of the stomach, that it is more the histology part. Then we will talk about the rest of the organ digestive system. Thank you for watching this video, and don't forget to give me a like, comment, and subscribe to this channel. Thank you. Have a nice day.